Yeah, Jack, a lot of noise coming from the street out there.
Is that what?
I'm hearing a closet from somebody opening.
Oh, it's my mother. Yeah.
Oh, I think we are.
All right.
I think we're live. There we are.
All right.
Yeah. So. Oh wow! Great. Okay. Great. Hi, Michael Miller here with our guest today is Dr. Jack Michel, who's the chairman of Larkin Hospital. It was really a front runner concerning testing for the COVID-19. So welcome, doctor.
Thank you, Mike.
And tell us what you've been doing starting and when you started doing it concerning testing.
So actually an interesting story. We about a couple of years ago, we had a patient that had a viral cardiomyopathy. His heart has a disease that affected his heart, and he went to Germany to get a biopsy. And we developed this relationship with a German doctor who specializes in cardiac virology. And because in the United States, you can't get these biopsies done uninterpreted. He has the only biobank in the world. And so after this first person was treated, he's 26 years old. He's told he needs a transplant, and he has 10% ejection fraction, otherwise normal up until then. This happens to about 300,000 people in the United States every year. Most of them get better, but some end up progressing to transplant or dying. And so he decides he wants to go to Germany to get the biopsy done. He gets the biopsy done. They find out it's a parvovirus, which is kind of a cousin of coronavirus, and he's treated with medicine, with interferon. He does perfectly well. He's back in the United States doing great. And he talks to the German guy and he says, look, we need this in the United States. So he convinces him to ship all this biobank to us. So we have the only virology biobank for cardiac biopsies in the United States. And we run samples for every hospital out there. In January, we talked to this German doctor, and he's talking about what's happening in Wuhan and saying that this is coming to the US and that what we need is a high output machine that can do a lot of testing. And so the patient and myself, we put something together to bring in what's called a Panther Fusion, which can do 1,200 tests a day. Normally, health departments obviously are not prepared for pandemics. They can do maybe 30, 40 tests a day. But obviously, what worked in the rest of the world was to have these very high output machines that can run thousands of tests. So anyway, we had it deployed in about February or so, and it was ready to go about 4 weeks ago. And we started mass testing. Right now, we have already over 8,000 people tested in a matter of a few weeks. We found 1,200 people who are positive for the virus. We have a team of contact tracers and peer support working on making sure that they don't spread it any further. And then in addition to that, they're donating plasma. So we have convalescent plasma donations, which is a lifesaver for this condition. Right now, we have 40 units of convalescent plasma of every single blood type.
Yeah. So let me, by the way, Dr. Tina Carol Scott, who runs the Children's Center around the corner from the hospital, is tuned in. Also, Renee Gim, who's a fan of yours, and Gloria Burns. Somebody just mentioned here that Germany handled this much better than we're handling it. Now, you're a front runner in this. And is there something that they've done that we should be doing as far as testing?
Well, yeah, this is very basic to deal with this virus. Is you kind of copy what everybody. You look at the countries that did it well, and the countries that did it well are basically South Korea, Singapore, Hong Kong, and what they did was they did early, aggressive, high volume testing and contact tracing. As far as testing, of course, we're behind the curve. We started behind the curve. The FDA has a very cumbersome process as far as doing the emergency use authorization. As a matter of fact, when we were ready to do our drive-through 4 weeks ago, we didn't have reagent. We couldn't get the reagent. So we had to do an agreement with another laboratory called BioReference Lab to let them help us in the meantime, which was by the grace of God, honestly, because we had everything ready to go. And they said, oh, by the way, we have the emergency authorization is ready, but you don't have reagent. I said, what's the point of having that if you can't run the test? Right. So we would have been delayed 2-3 weeks. So those are the two things that need to be done. From a contact tracing perspective, in order to do the same amount of contact tracing that was on in Wuhan, where the disease started, it's estimated that we need 250,000 contact tracers in the United States. We have 2,000. 2,000.
Here's what a lot of people, including myself, need some clarification on. We hear the answer to this is testing, is testing, is testing. In other years, back from March before, it was treatment, treatment, treatment. So what does the testing do? Why is that so important?
Because the only way that you can break the contagion chain is by knowing who has it, especially because a lot of asymptomatic or very mildly symptomatic people have it. When we did, I can tell you, we did the testing. I remember it was on a Saturday, Friday, and the results came back the next day. And that day we only tested like 50 people because we did like a half a day. And we started getting the 20 people. I don't remember how many people were positive, and I was just very alarmed. Number one, because we saw for ourselves that some of these people had absolutely no interaction with anybody that came from the outside. This was definitely community spread. And the health department had said that they had seen evidence of community spread, but this was like community spread everywhere. We had multiple patients who clearly got it in the community, were not travelers, had not gone anywhere. They just got it inside the community. But the stories were even more perplexing. You had a nurse that worked in a hospital ICU in a local hospital for 2 weeks with a cough. Told everybody, I think I need to get checked for coronavirus. And they told her, no, yeah, you don't have that. In an ICU of a hospital, there was a gastroenterologist for 2 weeks. He had a little sore throat. Who knows how many patients he saw or he interacted with. So if you look at that, we have police officers, we have people that interact with people on a daily basis and have multiple contacts. So it's super alarming because, obviously it just showed that the extent of the disease was here. We probably should have started this a month before that to even had any chance.
It seemed obviously the days sort of blend in to each other, and I understand there's extreme stress that's going on, and our regular rituals, go out for dinner Friday night or Saturday tennis, whatever it happens to be, those are all gone. So people are in a lot of stress. And so when I'm looking at the people that are asymptomatic that are being tested, then the county has done some. When this first started, if you didn't have symptoms, you couldn't go get tested. Do I have that right?
That's absolutely right.
But there seem to be some reports that are saying that they've done a lot of testing, random, and a lot of people are asymptomatic, but they're shedding that virus to people.
Well, we actually had examples of it ourselves. We started telling people, we actually had an online form, we still do. If you get tested with us, you have to fill an online form. And if you didn't press a symptom, it actually sent you a message saying you don't meet criteria for testing. We took that off now because now we're basically just, if you want to get tested, please get tested because you're probably spreading it. If you have a reason to believe that you were exposed to somebody, you probably should get tested. But anyway, people would lie on the form and said that they had a symptom. The reason we found out was because we called them back when they were positive. And we said, you reported the symptom. They said, oh no, actually I didn't have any symptoms. I was just worried. So I said, wait a minute. So 20% of the people that were positive admitted that they lied on the form, that they only got, I'll give you an example. There was 2 Mexican tourists, right? They were having dinner with 8 other people. There was a table of 10. The reason they got tested with no symptoms is because they found out 2 people in that table were positive. And so they were just curious whether they were positive too, even though they had absolutely no symptoms. Well, the 2 of them were positive. I can guarantee you that whole table of 10 was positive, and the waiter, and who knows who else in that restaurant. So that's how bad this virus can spread. And that's the danger of it.
So I did a little test the other day. I sat in my truck on the phone, windows closed, air conditioned on, and I was talking with somebody. And then all of a sudden I'm realizing I'm spitting out these tiny little things are all over, right? And oh my goodness. And so when you realize that stuff in the general population is sort of invisible, well, when it's enclosed in there and it's just you realize how fast this can spread. I might add, by the way, that I did have testing done at one of your facilities in Hialeah, and I'm really delighted. I did it twice. I had a little cough, and my wife, of course, she wanted me to go do it because she's been at home for, at this point, it seems like
even though I was trying to convince you not to do it, but you still.
So happy
But
wife.
I'm glad she's happy.
but the process there was so good, right? And now that I see what you did a month or 6 weeks ago, the county, because it was so big and the feds are so big, now they're doing even walk-ups, and you go, wow, if that would have been 6 weeks ago, you would have had them all arrested. So the part that is really curious is what percent of the population do you think is asymptomatic, but at some point was spreading it?
It's hard to say, but I can say that from the people, from our cohort of 8,000 people, we're maintaining like a 20, 30% asymptomatic people that are saying that they're asymptomatic. I think the dangerous ones are the ones that don't care or don't think they have it. And that's the danger of some of the discourse that's going out there by some people that are basically saying that, well, then, you know, we're things are better. We're gonna. I got an email yesterday from a dentist group saying that because of relaxing, and nobody said anything about relaxing anything, but because of the relaxing criteria now, they were going to start seeing patients. And I was like, wow, a dentist office. That's kind of, you know, but anyway, I feel the pain of people that want to get back to work. I get it. But I think there's a point where you have to think, you know, how many deaths is this going to lead to? Because it's not the young person that came and, you know, had, you know, either went to the restaurant or went to the dentist office, or it's the person, that person can give it to three, who can give it to three. And before you know it, you know, people don't know what exponential means. I don't know if you know this. You know the story of the guy who was playing chess with the king, and he said that, he said that every time like the king wanted to congratulate him for, or give him something, some financial reward for playing with him, and he said, "I'm going to offer you this and that." And I said, "Oh, you're too generous, king. Actually, we'll do is that for every if I win the game, for every piece on the chessboard, you give me twice the number of." So it's a multiple factor of 2, and then it said, "Oh, so you mean for everyone I give you 2? Okay, no big deal." So, but then the 2 becomes a 4, and then the 4 becomes an 8. That's called exponential. This is how this virus works. And at the end of the day, the helper for the king goes, "Well, king, you know, we don't have enough money to pay this guy." "What do you mean we don't have enough money to pay him?" He only said, "For every one you get 2." And he said, "No, if you do the math, he asked you for more money than we have in our coffers, because this is how much we owe him now." But that explains to you how this virus multiplicates and how dangerous it is.
So right now there's so much, I don't want to say conflicting information, there's a lot of information. And the other day concerning the economy, the conversation coming out of Washington, one guy says this will be the worst recession ever. And then somebody else in Washington says, well, it's going to last a couple months. So as we look at the national news and we go, okay, here's what's happening in Georgia and Texas, in New York. But for us here in Miami-Dade County, ultimately, this is, if we're going to get infected, it's going to be from the people with whom we associate here. So where do we go for the best local information concerning this virus?
I mean, I've tried to be as accurate as possible. Every time I hear something new, there was a weekend where this particular weekend went by, and then on a Monday or Tuesday, you know, we were calling all our people that get test positive. So we found out like 2 or 3 of the people had said that they had gone to funeral service, not the same funeral service, multiple different funeral services. And I put something out saying, don't go to funeral services. And when I asked people, I said, oh, you know, somebody in Washington or somebody said that 10 people was okay. Well, 10 people is not okay. You know, the virus doesn't count how many people there are and says, oh, it's only 10 people, so I should not go in there. The virus could be in one of those people, and they're all crying and they're all shedding material. And that's obviously everybody's going to get it. There was a doctor, at one of the local hospitals, her young brother died, and they wanted to do a funeral service. And she reached out to me because she wanted to get some of the people tested, like the older people. And I said, wait a minute. The purpose of doing this is because you want to get, she was testing the wife and the son to make sure that the elderly people that showed up to the funeral wouldn't get the disease. And I said, look, unless you test everybody, and even if you tested everybody today, you don't know that they could be spreading it tomorrow, because the test is only good for the day that you test. And so I told her, my advice is don't test anybody. Just please don't don't celebrate a funeral service. I don't think he would have wanted you to do that, because I don't think the last thing he wants is for his parents to die. So that's what's happening. So I'm trying, as much. There was a report over the weekend by the New England Journal of Medicine where they went in one particular nursing home. They found half of the people got infected within a very short period of time. So now the recommendation is like every 2 weeks you should be testing people, because basically we did a good job. The state did a good job at keeping people from visiting. But what they didn't realize is that the people that work there are coming in and out, and they're being exposed to husbands and wives at work. So we left a big gaping hole. And you take their temperature, that's not going to tell you anything. They may not have a fever. They can still spread it.
So a couple things before I forget. Joe Wright Wood, he says, many thanks to you for updating daily. And I follow you, with you on Facebook all the time. Congratulations on doing that. So let's look at the percentage of people that have been diagnosed with this, and the percentage of people that have died from that seems significantly high. It looks like, what percent do you think that it is for the people that are diagnosed with it, the reports that we see on CNN, and what percentage do you think that it is?
Well, we're seeing 15%, 15% pretty consistently on the people that get tested. I think about a month ago, I sent out a notice on Facebook saying I thought half of the population, this is before the social distancing measures were implemented. And I said, look, if things keep going the way they are, more than half of us are going to get this thing, because we're basically not doing it. We're just basically doing the same thing. And this thing is already here. It's been here for probably a month or two. I think some people, I've talked to some people, said I had the exact same symptoms in January. I had the exact same symptoms in February. So it's been around. We kind of left it grow for a while.
Yes.
So that's why those percentages, it's hard to tell the percentages. What I can tell you is that it was, I sent a post and I said, where are you more likely to get contaminated with coronavirus? And so I took all of our patients. Like at the time, I think we only had like 500 people. Now we have more than probably about 1,500 today. And I said, okay, let me classify them by profession, right? So there was a truck driver, there was a guy that worked at Publix or another, at a supermarket. There was a guy that worked in a doctor's office. There was a guy that worked at the airport. There was a guy that worked for an electrician. There was a guy that worked in housekeeping. There was a guy that cleaned the houses. There was a doctor. There was a dentist. There was an optometrist. This thing is everywhere. I mean, there is no place that you can possibly go to where there wasn't somebody that we tested. So I said, have you been to any of these places? Gas stations. Have you been to any of these places? Because if you have, your chances are not that low. You go to Costco, you go to the supermarkets, and now they're at least, I see them, people are practicing the social distancing. But my wife was telling me yesterday, I want to see my sisters. And I said, I'd love to see your sisters. Let's see them on Zoom. And they said, well, no, but it's not right. It's been a couple of months. And I mean, if you guys are listening, this is, I know you might miss your sister or your brother. It's not a good time to get together. It's really not a good time to get together.
So a couple things I do. There's somebody in Sunny Isles that says here, he thinks the apartment buildings in Sunny Isles, of which there are dozens of them, and small elevators, all right? He said that's sort of like the cruise ship. So the question is, when is it going to be safe to go out and play, doctor?
This virus is going to be with us for at least a year and a half. I don't see it going away. I don't think it's going to be safe for a year and a half. I don't think whether we relax, there are some places in the country, we have a group of contact tracers, about 300 volunteers from all over the United States who are helping identify and track people. And we're actually developing an app for that. And, we really believe there's some places in the country that Missoula, there's a place called Missoula, I think it's in near Michigan. And they have a health department where they have a contact tracing team that they're putting stuff out every day, how many people got tested. They have plenty of testing capacity. They don't need any help. They could probably reopen tomorrow as long as they don't let anybody else into the town. I could tell you the town in Hialeah, where we're doing a lot of our testing, And now, thank God, the state just opened something up for free in nearby. So I think Hialeah is getting a lot of testing right now. I was going to tell the mayor, if you want to reopen, I think you should close all access to Hialeah. I think just leave them inside Hialeah, and then let's make sure we test anybody with symptoms. And you probably could reopen the city as long as you don't bring anybody from the outside, because I don't know what's happening in the other cities. I can tell you, Palm Beach is behind in testing. Other areas of the state are behind in the testing. So it's a very local issue. It's a very local issue.
So let's look at it. So there's some people, they can control who they're around. You know, they can be at home. They go to the grocery store and try to keep people away. And maybe the job they have is with the same 10 or 15 people. But if people live and work in tall buildings, how are they going to get upstairs? How's that going to work?
Yeah, well, let me just say, okay, so the issue with this virus is not that it's in the air. So there's a lot of, so yes, you're in a small elevator. Look, going back a little bit about your comment about the spitting and stuff like that. Yes, we do spit when we talk. We do that. There was a church in South Korea where basically they were singing. They were singing inside the church. And when you sing, you're actually pushing those droplets out, and they stay in the air a lot longer. In a close situation like that, if you're not wearing a mask, obviously, yes, it can be, you can get those droplets. It's not aerosol. It's actually the drops themselves. And then you touch your face, and then you touch your mouth, or you touch your nose, and that's how you get the virus. Or you rub your eyes. But in most situations, if you're wearing a mask and you're constantly cleaning your hands, and you make sure that you never touch your face, that you never rub your eyes, which is very hard to do, by the way. Just monitor yourself for the next 2 or 3 hours and count how many times you touch your face. It's just, we do it as humans, which, yes, Purell, exactly. Or I'm not advertising Purell, but any hand sanitizer works. It doesn't have to be Purell, but just make sure you keep your hands clean. If you touch a button in an elevator, those buttons have coronavirus. So you just make sure, okay, I just touched the button. I'm going to now Purell my hand. If you do that, you're not going to get it. You're not going to get it because you live in a building. You're not going to get it because you touch elevator buttons. You're only going to get it if you don't clean your hands and you touch your face. That's the only way so I don't want people to be freaking out here about this thing being around when you walk past somebody. It's not the way at all. By
the way, I know Rodney Barreto, you might know him. I know he cleans his hands all the time. I see he's just checked in. So Rodney, we're a believer. So I see that Southwest Airlines, I think they announced it starting whatever day, you're gonna have to wear a mask, right?
Yeah.
So when I look at, okay, so that might stop some of it. But one of the things that we see, if you watch TV reporters, the wind has to be so strong before they'll even touch their face with the wind blowing out. So it is a habit that you have to unlearn, which is, you have it
completely.
It's an itch. So we think we have to itch it. What I've learned is, who knows where these hands have been, but in today's environment, I'm trying not to get it near my face. All right. And there have been some stories where people, when they get home, they go swimming and with the chlorine. Is there any truth that might help a little bit as far as washing your body?
I don't think so. I mean, I think it makes a lot of people feel better, but I honestly don't think so. The one thing, before I forget, the one thing that everybody that's listening should be doing right now, today, after watching Michael and me talk, is buy yourself a diary or find a book somewhere, a notebook book somewhere. And today, today I saw my friend, her name is so-and-so, because if everyone that's listening starts a diary, if anybody gets the disease in the next few weeks or months, because this is going to be months, we can go back 2 weeks in that diary and say, okay, these are the people that I had close contact with. Obviously, you and I can give it to each other right now, but if you were sitting here in my house, I would write, Michael Miller was here, we had coffee. Because when somebody called me and said I was positive, I would give that contact tracer your number. And that contact tracer would call Michael Miller and say, Michael, you saw Jack a couple of days ago, you had coffee with him, Jack's positive. So who do you live with, Michael? And then you're going to be quarantined now. And then we need to either test you or quarantine you. And then everybody that's around you is quarantined. This virus is transmitted within households. This virus is transmitted from mother to daughter, from father to son, from husband to wife. That's how this virus is transmitted. So that's why controlling that contact is important. So you got a teenager that's hanging out with a neighbor's kid. That neighbor's kid, you start multiplying the numbers. So that neighbor's kid saw two other kids who saw two other kids. And before you know it, your exposure is significant, because then your son comes home and he touches a surface. This thing could stay on surfaces for a day or two. Then you touch the same surface because you think your home is safe, and then you touch your eyes and you rub your nose.
You think we have at least a year of, listen, you can go out and play basketball, but do it by yourself and don't be near anybody else. The odds of that happening are none, right? You can go bike riding, you can go to the park, as long as you're not too close to anybody, and as long as you can say hi, there's nothing wrong with that. But what you can't be doing is touching anybody, touching surfaces, or touching people. I mean, we're the carriers right now. So, by the way, David Singer is a councilman in Palmetto Bay, says hello. He's tuning in right now. So, what is going to be the end answer with this, so that we can return to whatever it might be in 6 months or a year? What has to happen?
Okay, so clearly a vaccine. I mean, I think the only way we're going to get out of this virus is a vaccine. Now, having said that, we are trying a new medication called Sofluza. I don't know if you've heard about it, but it's kind of like the Tamiflu, except Tamiflu does not work for coronavirus. It does not work. Don't buy Tamiflu. It does not work. But we've been trying the Sofluza, and it's highly effective. We recently, the way, Michael, it's funny the way it happened, because people see me doing this stuff, and I guess some doctors in the community, there was this particular doctor who's been emailing Trump and tweeting Trump about this cure for coronavirus. And he calls me out of the blue and says, you know what, I've been using this for the last few weeks. I gave it to my daughter, I gave it to this person and that person. There was a cohort of at least 10 people. And it was kind of all the same thing. They took the Sofluza within 24 to 48 hours. They were perfect, which does not happen with this virus. This virus will last up 7 days of hell, worst cold you ever had. And then on the 7th day, you start getting a little bit better. So that's the course of this virus. So they took this medication, and it was funny because there was one household that had 8 people in it, and where he treated someone who had it. And he said that no one in the household got it because he gave it to the kid within 24 hours of seeing him. So we're prescribing Sofluza now to every inpatient at Larkin. As soon as they come through the door, they get the Sofluza. There are contraindications, the pregnancy, breastfeeding, obviously, any medication has side effects, but we're actually putting it out in the protocol. I think we're probably the only hospital in the country that's using it. Sofluza, Xofluza, you should tell your doctor about it.
So as right now, this is probably the first time in many, many, many decades that the whole universe is trying to figure out how to solve this. How many people do you think are working on trying to find a vaccine or a cure for this?
Oh, tons of people. But let's not believe that somehow it's going to happen in less than a year and a half, because it's not going to happen in less than a year. So I know people are very hopeful, because I keep hearing some reports about in the fall. It's just not going to happen. It's just not the amount of work that goes into developing a vaccine. And I hear, oh yeah, we got a head start because of SARS. Yeah, we got a head start of maybe a month or two, not a year or two. So it's a long ways off. You should count on being with the social distancing for a long time, at least a year and a half, before a vaccine comes out. But it doesn't mean that we can't do something. I mean, it doesn't mean that we can't take action, and there's also treatment that seems to be working.
So my hat's off to all the frontline people, the nurses and the doctors, and the candy stripers and the people that clean the hospitals, and everybody that's involved in that. Then we also have the police that are down here that are going to a lot of people all day long, along with the firemen. And so here, and sometimes it's something violent that's occurred. So what is it that the police can do that you can suggest so they're a little bit safer than what they might be doing now?
I mean, I think they're getting a lot of in-services on this. I mean, the CDC has a whole website when you show up to somebody suspected of COVID, exactly what you need to do is for first responders. But it's pretty straightforward. Is wearing the mask, is wearing protective gear. I mean, as far as definitely gloves and things like that. Now, the gloves don't protect you if you rub your face. So
Right.
you should keep that in mind. But you can have a glove all day long, and then you just picked up a bunch of coronavirus, and then you touch
So
yourself.
I got a question for you. Let's say you go to a restaurant and it's takeout and they're wearing gloves, and then they hand you the cup.
Exactly. You said it.
And then we
Honestly,
take
I think look, I feel for the restaurant owners. I think they should experiment with home delivery. I don't think people that are in the same mind should be going into a restaurant right now. I don't, even if they reopen, I would, you know, and I look, I understand it's an important part of the economy, and that all of these people have mortgages to pay and people to hire and waiters, but let's think of ways. I mean, look, local restaurants around my house are, I order from them all the time. Like my wife says, "Hey, I wanna have a Morton steak." Hey, great, let's order it. You know, have it in your house, put a candlelight, get a bottle of wine. You can still patronize those places that you like, the food. They're open. Actually, they're open. You don't have to go sit there and get exposed and expose them to you. So I mean, I would I think that's one thing we could all start doing. I mean, I'm sure your credit card bills are a lot lower now because you're not taking your wife to dinner. But but maybe, you know, start patronizing these places that you like so that they don't close permanently.
So tell us about what the next 6 months looks like for us here in Miami-Dade County. If you, what is it?
I think it's going to be more of the same. I don't think you get. I mean, I think that you know, unfortunately, you know, the politics mixed with science is not a good mix, because obviously the politicians have a lot of pressure to, and it rightly so, because, you know, I mean, you want to get reelected, you're not going to get reelected saying you're going to close down the town for 2 years. So nobody wants to hear that. So I get it. I get the point. But the question is, you want to be reelected, or is it you weigh that against people dying? And I think at the end, people that are conservative, I can tell you, Mayor Hialeah consults me. I told him that any decision he makes, we're going to get a group of epidemiologists to actually look at the data. Because I think if you're able to, if you have a town that's really a closed town where people don't need to come in and out, where all the businesses are in there, and other than suppliers back and forth, you can control it, and you have sufficient testing, I think you could, in some ways, you know, have some liberties in that town. But this thing about reopening the entire county is not the same thing to do.
I think the Florida Keys, because they were able to do it, all right?
The problem with the Florida Keys is that they haven't done a lot of testing. That's the problem. So we don't know how prevalent it's down there. They've done very, very little testing. They're trying. I mean, I heard that Dr. Miguel Diaz has an office there. He has a big family medicine office, and he asked us to do some of the, help out with some of the testing. And I think they authorized him to do like 1,000 tests, which we'd love to do. We also, you know, we work with CHI. We do all their testing in our lab. So we work with a lot of different people that want to do testing, but I think the Keys are dangerous right now. I don't think, you know, I think that you need to, there needs to be more testing. And, you know, the beauty about a place like the Keys is that you can test a lot of people, you know, and you can actually, you know, make sure that you have it under control. Now, how do you handle people coming from the rest of the Florida and visiting them? I think it's a danger. I mean, I think it's a problem. But how does the economy survive, right? How do these restaurants stay open?
Between the scientists like yourself and the physicians and then everybody else. When we look at the science of it, it's a non-emotional issue. You look at these are the facts, and you say, "Oops, I got to eat today." All right. Now the county's opened up some public places, and it sounds like that over a short period of time, meaning in the next month or two, there's going to be more and more places that are opening up. So your suggestion to the average guy who's going to be back and working in the store, the employment in end of May or June and July, for somebody that's working there, number one, what should he do all the time? Number two, can people that are non-symptomatic go to get a test because they want to know?
Absolutely. Well, first, I mean, what we discussed, the only way for this virus to get into your body is if your hands are dirty and you touch your face. So if you wear a mask, the mask is not going to protect you from getting it from the air, but it will make you conscious of touching your face. You're not more like, exactly, there you go. You're not likely, and by the way, it doesn't have to be a surgical, it could be a bandana. It doesn't really have to be like a hospital grade mask in any way. I see people walking around with N95s. Please return those to the hospitals. They need them. You need the N95s when you're doing a procedure on a patient, like a bronchoscopy, and the stuff going up in the air. You're not in that situation. So you just need to cover it so that you're not spewing out stuff and you're not touching your face. It doesn't protect you, it protects other people from you. It's the other way around. But if everybody wears the mask, it's protected for everybody. Yes, we started already doing asymptomatic testing. We actually, so even if you check symptoms, you still can get tested. We're starting also the antibody testing. That's the other misconception about antibody testing. We're offering it, but do you need it is the question. And my answer is you probably don't need it because it's the next sexy thing now is antibody. Everybody wants to have the antibody test because they think that if they have the antibody test and they show that they had IgG, which means that maybe they had the virus before, that somehow they're immune. We don't know that. We don't know what that means. We don't have any studies that show right now that because your IgG, you have a positive IgG for this virus, that somehow you're protected. We don't know. So don't waste $150. We charge $150, but other places charge more. Don't waste your money on it. I don't know if the insurance companies would approve it or not. I hear that they might, but I mean, even for the sample or the insurance company, this is an epidemiologic test. It's basically to see what percentage of the population has been exposed to the disease. Maybe we know people that could be exposed to the disease and not have an IgG response to it, and it doesn't mean that they don't have the antibodies to it. It's just a flaw of the test. It's not a perfect test.
But we continue to hear that there's a lot of the testing that comes back inaccurate. All right.
Correct. Especially the dipstick stuff. Don't take the that stuff that you get from China and shows up in your house via Amazon and it's a self-test. Forget that stuff is garbage. Don't waste your money on that. If you're gonna have a test, have a blood test. But I can tell you the blood test is not accurate either. It's only good for epidemiologic reasons. It's for researchers to figure out, okay, we think the prevalence of the disease is 30% or 20%, or what percentage of the penetration is in the population for studies. That's the only purpose of that test.
Okay, so we're getting ready to wrap up. Again, we're with Dr. Jack Michel. He's the chairman of Larkin Hospital. I do want to say hi to Jeff Garcia, who's very active in South Miami and around the county. Thank you for checking in, Jeff. And again, so Dr. Michel, you have one of your hospitals in South Miami on 62nd Avenue. You also have the Palm Springs Hospital off 103rd Street. That's where I went for my testing 2 different times. I'm really delighted. I'm proud of the process. I'm so proud of our neighbor, you, down the street, for being a front runner on this. And my hat's off to you. And what is it, put aside this virus right here, what are some of the other things that you and your team are going to be working on?
Well, one thing we've done is this plasma donation. So we developed the whole team to basically approach the thousands of people we've tested about plasma donation because it's life-saving. We're using it actually within 23 hours of admission to the hospital. You get admitted to any Larkin facility, and in any situation where we think you're compromised, you're going to get plasma. You're going to get fluorescence, you're going to get plasma. Since we started doing this, we've had 0 deaths. So I think that's the way that's the treatment protocol right now that should be adopted by every hospital. It works. There are some paperwork issues with hospitals accessing blood banks. I think it's silly. I think if you have a family member who's currently on a ventilator or about to go on a ventilator with coronavirus, there are 45 or so units of plasma that the blood bank that we work with, this American Blood Bank, has right now in stock. You just need to tell your doctor and your hospital that they shouldn't be sending you on a wild goose chase to go find a donor. This is the silliest thing I've ever seen, Michael. They tell these family members, go find yourself a donor that happens to have the same blood type of your family member who's dying in ICU. And by the way, that also had coronavirus and is now negative, symptom-free for 2 weeks. Now you tell me how you're gonna do that when you're grieving for someone that's in ICU and you can't even see that person. So honestly, guys, if it's available, access it. Call the blood bank and just order it. That's all you have to do. and it takes some minutes to order it, and so this is available, and there's no reason why people should be dying because there's no plasma. There's plenty of plasma in our community. This blood bank is accountable for every donation that we're getting to, giving them, and I'm actually keeping them from selling it outside of the state. I'm telling them keep it in Florida.
Good. And we like local, local, local. All right. And so again, Dr. Jack Michel, Chairman of Larkin Hospital, thank you very much for your time. Continue working hard and saving lives. And it's been a real pleasure. I want to say thank you very much to Barbie Pons, who's produced the show today. Thank you, Barbie. And I think that's going to be it. Dr. Michel, have a great day. And
Thank
Barbie,
you. Stay safe.